Good afternoon, everyone. Can you see me, Gary? Good afternoon, everyone. My name is Ivonne Herrera. I'm the president of the Resilience Engineering Association. I'm thrilled to be the moderator of this session that is associated with the joint initiative that Resilience Engineering Association and Naturalistic Decision Making have. And on behalf of the Resilience Engineering Association, I would like to welcome you all, in particular the Gary Klein from the Naturalistic Decision Making community and Sudeep Hegde from the Resilience Engineering Association, who kindly accepted to jointly work for this presentation. I know that they have been working very hard. They have also prepared handouts, and I will put the link to the handouts in the chat. You have received a link with your presentation. And the objective of this session is focus on comparing tools and methods related to naturalistic decision making and resilience engineering. We will start with the view from naturalistic decision making from Gary Klein, and then we will continue with Sudeep Hegde. And we will finalize with your questions and answers. In terms of logistics, please note that the talk is recorded, and to optimize audio, microphones of the participants are muted, but then during the question and answer session, we will unmute everyone. In case that the webinar is hacked, we will record it and post it in our website. And please feel free to post questions. The webinar will be conducted as a dialogue, and we invite you to debate and to share your knowledge. And without further delay, I would like to give the floor to Gary Klein. Please, Gary.
Thank you, Yvonne. Welcome to this webinar Sudeep and I have prepared for you about tools of practice from each of our communities, from the resilience engineering community and the naturalistic decision-making community. Let me give you a little background about how this came about. We have a joint conference in June of 2021 between our two communities, and we'll be putting on this conference. And we said, rather than just wait until June to have the collaboration, we should be having collaboration all during the year so that the two communities can learn more about each other. And so with Yvonne and others have arranged to have a series of webinars. And along the way, Sudeep and I were talking about what are the tools that each of our communities have, and how can we learn about the tools that the other community has been using. And as we started to put that together, we realized we have the basis for, I think, a useful webinar to describe what tools we've identified. And we've assembled those in the handouts that you should be able to access through the link. Along the way, we wondered, how are these two communities conceptually related? And I only have one slide about the conceptual issues for the two communities, and then I'll talk about the tools. But here's what Sudeep and I have come up with. The naturalistic decision-making community, our concern is about expertise, whereas the resilience engineering community has a concern with adaptability. The NDM concern focuses on the individual decision maker. The resilience engineering community focuses on organizations. The NDM community is interested in cognitive models. The resilience engineering community is interested in laws that govern cognitive work. So the two communities really have very different approaches, but we think very compatible ones. And that's part of what's exciting us, is to see how these two different perspectives can relate to each other. We also learned, Sudeep and I, that there are some common issues. We realized that organizations usually don't notice expertise or resilience within the organization. Organizations usually don't protect their own expertise or their own resilience. They usually don't work to develop their expertise or their resilience. And as a result, expertise and resilience can diminish. And that's a signal for the importance of what each of our communities is trying to accomplish. So what are the differences between NDM and resilience engineering? How can they complement each other? We are not going to approach those questions in this webinar. This webinar is about tools, but we expect that there'll be other webinars that will address these questions. I'm going to start by talking about the NDM tools. And the NDM tools are described in your handout. And the categories are tools for eliciting knowledge, tools for developing cognitive specifications, tools for training, tools for design, for evaluation, for teamwork, for risk assessment, for measurement, and for conceptual discrimination, conceptual descriptions. So it would take a long time to go through all of our tools and all of the resilience engineering tools. I'm just going to talk about 4 of the NDM tools, and these are the ones that are underlined. Critical decision method, shadow box for training, concept maps for evaluation, and a pre-mortem method for risk assessment. We'll start with the critical decision method as a type of cognitive task analysis. Why is this important? Well, without cognitive task analysis, we never would have developed the recognition prime decision model of how people actually make decisions. Without cognitive task analysis, we never would have formulated a data frame model of sense making that's used in the intelligence community. We never would have figured out how nurses in neonatal intensive care units can spot early signs of sepsis. They couldn't describe it, but using cognitive task analysis, Beth Crandall and her colleagues were able to determine how they did it. We never would have been able to cut a nuclear power plant emergency response operation by half. They were trying to improve their performance. They thought they needed more staff. In fact, they did a better job with half the staff that they had. We never would have designed a system for Air Force weaponeers. Jim Staszewski at Carnegie Mellon never used cognitive task analysis methods along with others to figure out how a new generation of minesweeping equipment could be effective. So those are some of the advantages of CTA. Let me give you some more specific examples. Because in NDM, we're interested in expertise. We're interested in tacit knowledge, which underlies expertise. And tacit knowledge is very hard to identify, very hard to get to grapple with. One aspect of tacit knowledge is the mental models we have. Can we describe our mental models? Not very easily. So does that mean we can't do anything? Or is that a challenge for how to try to get at people's mental models? One project we did for Procter & Gamble was designed to try to get at the mental model of housewives and homemakers in using the stain removal substances and products. And Procter & Gamble said, what are the mental models that they have for how these products work? So we started out by just asking them, what are your mental models? And they looked at us like we were crazy. How could they describe? They had no idea what we were talking about. And they claimed they had no idea how these products work. They just used them. So it looked like this was going to be a failure. But we don't accept failures easily. So we enlisted the help of a colleague of mine, a graphic artist, and we had a couple of different ideas for how these stain removal products might work. And he drew them out for us, and you can see these drawings here. Then we went back to the participants and we said, here's 3 different possibilities. Which is the closest to what you think is really going on? And they would identify one or the other. And they'd say, it's really the one in the middle, but not exactly that. You have to modify it in these ways. And all of a sudden they were describing their mental model. So there are ways of getting at tacit knowledge, just not straightforward ones. And that's the way we try to operate. Let me give you another example. This was a project for a sponsor, a large defense company that wanted to use a training method we have called Shadowbox, and I'll be telling you about that next. And we figured it would be a defense, a training project with some defense area. It could be aviation, it could be naval, it could be infantry. We were ready for any of those. And they said, no, we don't want any of those. We want to train our engineers on systems integration responsibilities. And we backed up and we said, really, really, because we don't know anything about, we're not engineers, and we don't know anything about systems integration. Can we choose one of the more straightforward military applications? And they said, no, this is where we have the need in systems integration skills. And so we thought this is going to be a disaster. And then, but they were determined. So we said, well, we'll plug along. We'll do cognitive task analysis interviews, critical decision interviews about tough cases. And we showed up for a week of interviewing. And as we suspected, they already had systems integration training. We knew that they had their own training and they wanted to improve it. What we didn't know until we arrived is that they had their own training manual, 42 pages, dividing the 5 phases of system integration, 42 pages plus annexes. And they hadn't shown it to us before. They said we couldn't take the manual with us. They'd let us thumb through it. And we looked at the manual and we thought, they already know everything. What can we tell them? But we went ahead and we did these critical decision method interviews about tough cases during the week, and we quickly realized what we could tell them that they didn't have that was included in the manuals. What's left? These are the things that were left. What can go wrong? Where are the tough decisions in this process? What makes situations difficult? How do engineers get confused? What kind of mistakes do they make? How do you recover from mistakes? How do you do the trade-offs? These are the cognitive requirements for performing the task well. And these appeared nowhere in the manual. And they're gained through experience. They weren't captured in the course or in the manual. And at the end of the week, we didn't say we'll go away for a month or two and analyze our data. At the end of the week, we described these cognitive requirements and we said, which do you want us to focus on? And they said, all of them. We need all of those things. So that's what a cognitive approach buys you. Another tool that I'd like to describe is a shadow box method that we've developed in order to address the problem that in training, you sometimes want to use subject matter experts, but they're costly and they're often not available. And so the idea of shadow box is to present people with complex scenarios. It's a scenario-based approach. And we interrupt the scenario with decision points. And we ask people, which option are you going to choose? Rank order them, write down your reasons. And then we've also had a small panel of experts go through the same scenario. They've written down, they've ranked them, they've written down their reasons. We've combined all of that, and we can show the trainee right on the spot, here's how the experts did their ranking, and here's why. Here's what they were seeing. Here's the implications they were identifying. Here's the problems they were spotting in the same material that you went through. And so the trainees are seeing the world through the eyes of experts, but the experts don't have to be there. And we've done evaluation studies to show a fairly significant improvement after just a half a day of training. Another tool that we have is concept mapping. And here, what the idea of a concept map is to access the mental models that people people might have in a domain, and to gauge their progress and specify misconceptions. And there's been over 50 years of research on concept mapping. Brian Moon and his company have developed an approach called Zero to use concept mapping for assessment. Rather than asking people multiple choice questions, you can have a skeleton map. You see that on the left, where there's a partial concept map, and people have to try to complete it and fill it in and make corrections. Or on the right, you have a build-a-map project where there's a set of concepts and you have to assemble them to create a concept map. And you can use these kinds of activities to make assessments about how sophisticated the people are who you're assessing. And then a final tool that I want to describe is a pre-mortem method. And the notion of a pre-mortem method is essentially for doing risk analysis. But there's a specific way of doing it, because you can just ask people, what are the risks in this plan? And you'll get some answers, but people don't really tell you some of the real worries. They may not even think of some of the things that are in their mind, in their subconscious, about what might be going wrong. So the way you do a pre-mortem is you tell the team, here's our plan, you prepare, that's step one. And then step two is you're looking at a crystal ball and the plan has failed. You don't know why, but you know it's failed, okay? So that's the starting point. Now, everybody in the team, everybody around the table, take 2 minutes and write down why the team failed. And then you consolidate the lists. You filter it in 3 different ways: the impact of what they came up with, how easy it is to reverse the problem, the likelihood of it occurring, and then you consolidate the lists. And now you have a way of doing an analysis. And it's amazing the kinds of items people come up with when they go through a pre-mortem assessment. We did an evaluation study with Beth Vienot and Sterling Wiggins and I about different methods to vet a plan. We did this back in 2010. Students were in college. The task was confidence in the plan. And for some reason, we had a plan about a potential flu outbreak on campus. Seemed unreasonable in 2010, a little less unreasonable now. And what you can see in the chart is that here's the baseline. Just asking people for a critique reduced overconfidence, reduced the confidence by a small amount, and then they would revise the plan, confidence went up. Asking people to do pros and cons reduced confidence even more, and after they revised it, it went up even more. Just having them do the cons wasn't enough, but the greatest impact was the pre-mortem. That had the greatest reduction in overconfidence and the greatest rebound in terms of improving confidence of the revised plan. So those are the NDM tools. I'm going to turn it over to you, Sudeep, to go over the RE tools.
Thank you, Gary. I'm just going to share my screen. Okay. So in comparison to naturalistic decision-making, resilience engineering, at least under the label resilience engineering, is a much younger field. I say under the label, although the precepts have a much longer history. So if you look at the handout Gary and I came up with, the resilience engineering tools are broadly categorized as knowledge elicitation tools and system analysis and assessment tools. So I call this list.
Sorry, Sudeep, you are in presentation mode. Can you share? You are sharing the wrong screen. Can you stop it?
Thank you, Yvonne. How about now?
I still cannot see the entire slide.
Okay, let me.
Perfect.
Okay, thank you. Yes, there's, I got these tools from a review of the literature by talking to colleagues in resilience engineering. And I also sent out a survey to the resilience engineering membership to see if they could contribute some tools, and I got a few responses. So it's not an exhaustive list of all the resilience engineering tools out there. I know I've missed out a few, and we can certainly continue adding to those in moving forward. Now, the majority of the tools that I've come across, I would classify them as system analysis and assessment, like the FRAM, for instance, which is very popular, and the resilience analysis grid. But we also have a few tools that have been used to understand from frontline practitioners and others in the organization about, to elicit their knowledge in a way that is pertinent to resilience. We don't, unlike NDM, I haven't really come across explicit tools for training and design and such, although some of the existing tools may have been used for those purposes. So some of you in the audience today might have used these tools for other applications. So we would love to learn from you later if there's time on other applications and tools that have been used in resilience engineering. So I'll quickly highlight a couple of tools here. The functional resonance analysis method of RAM, like I said, is very popular in resilience engineering. It was created by Eric Holnagel, and there's a whole community around it now. The goal of RAM is essentially to identify different functions in a system, like the function of giving medication to a patient, for instance, accounting, functions that are related to each other. And each function is defined in terms of 6 aspects. It's represented as a hexagon. So each of the 6 vertices represents input, output, control, a precondition, a resource, and a time. And as functions vary, they affect each other. There are dependencies between these different functions. So it becomes a way to see how variability cascades through the system as as functions progress. And to capture, basically it's a way to visualize variability and see what effects that has in the system. I'm not a FRAM expert, but I thought I will highlight it because it is very popular. This one is called Resilience Engineering Tool to Improve Patient Safety. So let me just share this other screen. This was a tool that I had created a few years ago and still using. You know, the goal of resilience, or one of the goals of resilience engineering is to learn about not just how things went wrong in, let's say, an adverse event, but to continually learn from the processes and the everyday adaptations in everyday work. So as a way to scale this sort of a process of learning, we created this form for self-reporting so that doctors and nurses in a healthcare setting can share their own narratives of how they've prevented a certain risk that they might have noticed, how they might have come up with different workarounds and habits and routines. So different formal and informal aspects of their own work, which help them function successfully. And it's also a shift from learning from specific incidents to learning from all kinds of situations, including normal work when there is no incident to really highlight. So it's a semi-structured form. It starts with a narrative where they describe an example of some sort of an adaptation, or it could even be a specific incident, something like a good catch or a close call. And then there's other aspects of that narrative that we try to probe and get them to respond. So things that went right, the kinds of challenges and concerns they faced, the kinds of resources that were used, and some demographic information. Now, this is a pretty generic form, very generic questions. It's not focused on any specific kind of issue, but there have been subsequent versions of retips which are focused on specific issues. The one that we are currently working on is in collaboration with the Children's Hospital of Philadelphia, in Philadelphia, and with the radiology department, because they wanted to learn about how their unit adapted to the COVID-19 situation and went through that initial period of chaos to reach a more stable state with time. So we've sort of tailored retips to infection prevention during COVID in radiology, and we're analyzing those responses now. So I'll come back to my presentation. Yvonne, can you Am I in presenter mode, or can you see my slide?
I see 2 slides at your presenter mode. Now it's better.
Okay, thank you. So the next tool, so the other example is that is very popular is called as the Resilience Analysis Grid, or RAG, which is also introduced by Eric Holnagel, where he defines these 4 capabilities of a resilient system, or sometimes called as potentials: monitoring, anticipation, responding, and learning. So I've created this sort of matrix form to identify these different capabilities at different levels of scale in an organization. So there's how these capabilities manifest at individual levels, at group levels, level 3 is the departmental specialty, and then the organizational levels and beyond. And you can, at least I've used it in order to map these different capabilities for specific issues across these different levels of scale. For instance, this was one narrative around how this emergency medicine department at a hospital deals with a frequent problem of violent behavior from inebriated patients who come in. So they need to monitor such situations, and they need to also be very aware of the resources that they have in terms of security personnel to address a potentially violent or hostile situation in the ED. Separately from they have some informal ways to do this monitoring, but separately from that, there is also hospital level training that is provided to security personnel to handle such patients. So I plotted both of those different solutions, if you will, on this matrix to show the complementarity between this top-down driven senior management resource provided training and the ground up workaround or innovation that the ED caregivers came up with. In this case, there is a complementarity. That this matrix could be used to identify a lack of synergy as well. So when there is perhaps not enough support to innovations or adaptations happening on the ground, or there are, let's say, policies that conflict with the workflows that are actually working for people on the ground. This could be a way to visualize those synergies or lack of synergy, and a way to communicate across the board for people from both the blunt end and the sharp end. And you can also reflect other capabilities like coordination, for instance, through the relationships that are defined within the matrix itself. So I'll hand it back to Gary for future directions for tools in NDM.
Right. So this was part of the conversation that, and Sudeep, could you continue sharing the
Oh, yes, sorry.
Part of our conversation was, what do we want to develop for the future? Not just what we have now. And each of us went to our respective communities to identify tools and to collect them and describe them in the handout that we've provided. But where do we want to go next? And particularly in response to the COVID-19 pandemic. So for the naturalistic decision-making community, one area that we're realizing is extremely important is what kind of tools do we have to learn about expertise as it is growing? In other words, how can we do rapid cognitive task analysis?
Sorry, Gary, Sudeep, you are still in presenter mode. Can you change it?
Oh, right.
Is it okay now?
No.
Now?
It's still not in presenter mode.
I am swapping. How about now?
Nope. I can proceed with this, Ivan. You can see this. Oh, there it is. Well,
Okay, yeah. Sorry about that.
not a problem.
Yeah.
All right. So in the midst of a pandemic, you don't have the opportunity to conduct 2-hour interviews or even 1-hour interviews with frontline healthcare workers. They're scrambling. They have all kinds of crises that they're responding to. And they're also scrambling to build their expertise. In the early days, you remember back in March and April, what were the cues for that a patient had COVID-19? There was a tremendous learning curve, a tremendous buildup of expertise throughout the whole healthcare community. A lot of it, there was some explicit knowledge, but there was also a lot of tacit knowledge as people learned to look at patients and look at some of the records and put cues together and see patterns. What kinds of rapid cognitive task analysis methods can we develop to capture expertise while it is growing in this kind of an emergency situation? So that's a real challenge for my community, and an important one, and one that I think we'll be addressing in the months and years to come. A second challenge that we have, if we want to develop training, how long is it going to take to develop training? Because people need training fairly rapidly as they are addressing various kinds of crises. So can we take existing scenario development approaches and either streamline them or replace them with faster, more efficient techniques for generating scenarios for an ongoing situation or crisis? Another set of tools that we're thinking about are perhaps ways to link general knowledge tools like the concept maps and maybe cognitive requirement tables and instance-based tools like the critical decision methods. And so to try to blend the specific with the general so that there's a tighter linkage rather than just make these as separate strands. So these are some of the directions that we've identified for future work. Back to you, Sudeep. You're on mute.
Thanks, Gary. So in terms of resilience engineering tools for the future, I just want to preface this by saying that to me, resilience engineering represents a paradigm. I think tools are important to enable that paradigm, but I think there's a reason why the vast majority of the literature so far in resilience engineering and discussions have focused on the concepts around resilience. I think it's, like I mentioned earlier, resilience engineering is a lot about looking for an organization to look inward, not just retrospectively after incidents, but to continually be learning about what's happening and to draw insights from those evolving processes at multiple levels of scale, individual to group to organizational and beyond, right? So learning is a key capability to that end. So we definitely need tools for learning, tools that have that sort of a focus. And in my own work, I have used tools like the critical decision method from NDM, but I've adapted it for the purpose of resilience engineering to learn about, and the big shift in that case was to expand beyond instances and incidents, to get people to think about their everyday adaptations, what seems normal to others or even to themselves, how do you open up their field of perception about their own work to identify adaptation, to identify interactions between different aspects of that overall system, and to identify dependencies, synergies, conflicts. So that was a key shift for me in terms of developing knowledge elicitation tools for the purpose of resilience engineering. And when you want to do this at scale organizationally, I think it's important to maintain that goal for learning. So future tools should have, in my opinion, have that focus. And it's important to also visualize what you're learning, visualize these insights and be able to communicate them to everybody in the organization. Visualize patterns of variability, synergies, conflicts, all of it. And we also need tools for design. So the question keeps coming up. So how do you actually do this in practice? Or what impact does it have that is demonstrated? How does it actually benefit the organization? So I think we need to start thinking about how to infuse this sort of thinking, this new paradigm, into various processes in every organization, in terms of how they learn, how they represent that knowledge, and how you can inform design of policies, design of processes, even the way technology is designed and used, so that you're better enabling their adaptive capacities and developmental and anabolic processes, if you will, and not impeding those. During COVID in particular, as Gary mentioned, the situation is rapidly changing. So there is a need to learn very quickly about how these capacities are being built by systems as they are happening. The crisis is not over. The waves come and go. So you may have gone through one phase of fundamental surprise, but more phases may be coming. So we are muddling through muddy waters. So it's important to enable these learning capabilities. So the last part of our presentation is focused on how we might blend the capabilities of the two communities, NDM and resilience engineering. And this is sort of also a lead up to the symposium next year. We want to collaborate, we want to synthesize our strengths and complement each other. So I think, again, the knowledge elicitation is what I'll start with. The tools that are available in NDM are very useful. For instance, the critical decision method, which has its semi-structured format and probes to get people to think about how they are thinking during past situations and make tacit knowledge explicit, is a big strength of those methods. But again, the shift for resilience would be to not just identify or unravel people's cognition, but understand more about the environment as well, about the system and what's happening around them. So I think there are some interesting directions on that front. Other capabilities like sense making and problem detection, which have been quite deeply explored in both these communities, are another ground for collaboration. And intersecting other core concepts, like the relationship between expertise and adaptive capacity. What does that mean for organizations? So individual expertise and skills as they grow, how can that help or complement the overall adaptive capacity of the organization? Those are some interesting questions to ponder about. And I think they can form a ground for very healthy discussion and potentially tools as well in the future. So with that, we will end our part of the formal presentation, but we're also very keen to learn from the audience who may have used other tools, developed tools, which are probably not in the list, or have experience applying these principles in their organizations. So I'll hand it back to Yvonne.
Okay, thank you, Gary and Sudeep, with this good preparation. And I'm very humble of all the knowledge that you have collected. I'm very glad that we can hear your views and you share knowledge. I would like to highlight the 3 tools that were inspired by the conversation from Sudeep, that they are mentioned in our newsletters from the resilience engineering. And these are tools that they are training for operational resilience capabilities. That is, again, has been used in Norway and in Brazil. The other is about repeat, actually, same name, that's as a similar name as your tool, that has been used in hospitals in Norway and in Sweden. It was developed in Sweden. And the last one is from the Resilience Engineering Network. They are trying to have a tool for learning from on time from the COVID. So that I put the links here. But as you mentioned, it will be very nice that everyone contributes with questions. And now we have some questions in the Q&A, and I also would like to give the floor. Let me just try to do this. David has some questions, and let me know if you want to allow me. Yeah, so please, David, you have some questions, and I will also read from the Q&A.
You should go ahead and read from some of the questions and first before I get going.
Okay, so we have from Nouf Al-Sahel. I would like to ask Dr. Gary Klein, where can we obtain more information about critical decision making and other articles? Are they workshops, courses, and so on? I just try to put the link to these handouts. Gary, do you have some answer?
So we've provided some links in the handout that is available to all the registrants. But since you asked the question, I would suggest you look at a book by Beth Crandall, Robert Hoffman, and me called Working Minds. And that contains a lot of specific information about about cognitive task analysis and about the critical decision method. That would probably be the best source I could turn you to.
Thank you, Gary. Then we have a question from Christine Vidal. Could you please explain the difference between learning and adaptive capacity? So I imagine it's for both of you, and maybe also Dave can address that. Gary, do you have?
I'll let you take a shot at that, Sudeep.
So I don't know if there's a contrast between learning and adaptive capacity. I mean, you can learn about adaptive capacities. So I don't know if your question is between expertise and adaptive capacity, but in my own methods or research, where I've done learning through knowledge elicitation, I've asked people about different situations and different practices in their own work, which I understand as adaptation or underpinnings of adaptation. So that's my approach.
Can I?
Yeah.
So, you know, the important thing to recognize, first of all, you pose it in an interesting way. It reveals one of the important switches about a resilience engineering stance on things that are in fact common across naturalistic decision-making, cognitive systems engineering, and especially the empirical side of resilience engineering. And that is that learning is about adaptive capacity, and learning is a kind of adaptive capacity. And that kind of mutual influence is part of what emerges when you take the resilience engineering stance, that you can't completely step outside a system, we're part of a system, which is illustrated by the pandemic, where we're all actors in the middle of the pandemic and its stresses at our different roles, levels, and relationships at the same time that we are students of the processes and decisions of people in crises and our findings apply, even though we're regular folk adapting just like every regular folk adapt despite our knowledge. The simple way to answer your question is it's all about revision. Adaptation is about the potential to revise, right? Your approach, your models, etc. So in that sense, it's all about knowing when and how to learn, right? So learning as revision and being poised to adapt is being ready to, right, revise, ready to respond to something that goes outside your normal ways of doing things.
Okay, so let me chime in here. So from my perspective, maybe you're asking about adaptation and expertise. So let me describe a criterion that we use to try to identify who's an expert in an area. And we find a lot of people who claim and present themselves, they claim to have expertise. And they show a lot of mastery of knowledge. They've got an enormous wealth of experience. They have a lot of criteria. They meet a lot of criteria for being experts. And so one of the criteria that we find is the most telling about who's merely very proficient versus who's an expert is to see what people do when they encounter a situation that doesn't fit prior experience. And people who are highly proficient, but no more, that's all that they've gotten to, they're frustrated that, this isn't what I was trained for. I'm not sure what to do. But the real experts, they're delighted. They're going to have a chance to go someplace that they haven't been before. And a related question that we like to ask is we ask people, tell us about the last mistake you made. And people often who posture as being experts say, I can't think of any. Whereas the real experts can always think of their last mistake because that's what makes them experts. They're still mulling over that mistake and what they should have done. So the real experts are always in a position, taking a posture of adapting and developing and improving and being excited about opportunities to stretch. Whereas people who aren't in that mode may look like experts, but in fact, they've really become stultified.
Well, Gary just gave a great basis for why NDM should join RE. Because your key finding, right? One of the key findings since 81, Rasmussen's Coping with Complexity, is we keep finding forms of adaptation and revision and willingness to adjust and openness to recognize. I think there was a problem detection paper that maybe a couple of people we might have heard of wrote that uncovered this about 15 years ago. And looking at all the studies here. And what do we find? We find that while you put it as expertise, the finding that you just so articulately and compactly presented to everybody is that these forms of adaptation or adaptive capacities are central. And so we build on that. And in fact, one of the key, usually my arguments and problems with what's RE isn't about NDM or cognitive work. It's really with other people using the word resilience as a label. And what do we normally say about our approach to resilience? And that is it's empirically grounded on patterns from studies of how people adapt in the face of challenge, surprise, complexity, exceptions, anomalies, etc. And as usual, Gary explained it all better quicker than I do.
Okay, I have another question, and I wonder if we can ask also Steven Shorak to join the floor. The question is from Nicholas Westbury. Has the systems thinking toolset come into either field? So I know Steven is here, and also maybe Smokes. Can Gary or Sudeep answer this question? It's about, has the system thinking toolset come into either field?
What type of systems thinking tools do you have in mind?
So the question is from Nicholas. I will ask Nicholas to join the conversation. Okay, let me try.
Although I suspect that the systems thinking tools that you have in mind have probably not had a strong impact on naturalistic decision making, and may have had a greater impact on resilience engineering, because it focuses more on larger systems and organizations.
Hi, can you hear me?
Yes, we can.
Hi, thank you for having me. It's been excellent so far. I've loved it. I'm come from the systems thinking tradition, way of thinking, and I'm quite aware there's 4 different or 5 different traditions that we could talk about just on systems thinking. But I was kind of coming it from the critical systems thinking tradition, where it's all about reflecting on consequences and perspectives, and taking different views about resilience. So treating it not as a realist proposition, but as something that might be a little bit more interpretivist, you know, in that sort of sense, or relative notions. It sort of brings to mind the ideas of, you know, what are we being resilient to what, for whom, how long, how, when, where, kind of ethical parameters that I would bring into this notion of resilience. And then over onto the idea of expertise. Do we ever use the kind of systems thinking way of positioning sense making? So this idea of reflecting on perspectives and things like that. So the trade of systems thinking, do we actually put that into the sense making tools that get pushed around? I'm sorry, I tried to put it as succinctly and clearly as I could.
Okay, so to the best of my knowledge, we have not used that perspective for building sense-making concepts or tools, but it does sound interesting, and it sounds like it's worth further speculation. That's part of the reason for these kinds of webinars, is to create these opportunities for cross-fertilization. So it looks like an interesting possibility to be explored. And Nicholas, if you'll send, or just maybe in the chat window, just post some references that we can use to become more familiar with that aspect of systems thinking, that would be helpful.
So Stephen, I have allowed you talk. I'm trying to put the video as well. Stephen has a comment, and I know systems thinking have been used in air traffic management and resilience engineering. Stephen, are you there?
Yes, I'm here. I'll talk without video if that's okay. I don't think you need to necessarily see me, but I think the question was about the efforts that we've made as within Eurocontrol to spread some fairly basic systems thinking ideas quite widely. So this obviously relates more, as Gary said, to resilience engineering. And really the aim of this is not to necessarily promote systems thinking methods to specialists such as ourselves, but to promote some pretty basic ideas about systems to the kinds of stakeholders that we have, which include managers and specialists of various kind, all the way up to CEO, and also the judiciary. So we work regularly with European members of the judiciary several times a year. Next week, in fact, so mostly with prosecutors, but also with judges. And when I introduce concepts of systems thinking, which underlie, I think, in many ways, resilience engineering and also systems human factors, systems ergonomics, quite honestly, they come as it's quite new information to them. And so it's to really try to promote a way of thinking that, everything is connected, economic aspects of work, the social, the societal, informational, technological, cultural, and so on. So that's really the aim of that, and also to present some fairly basic ways of using of employing systems thinking, such as influence maps and axiomaps, which I tend to use for normal everyday work in order to map influences. So yeah, it's something that we introduce not so much to specialists in human factors, resilience engineering, and so on, but more to people who think more atomistically about human performance. I hope that answers the question.
Okay, so let me take this opportunity to reverse field. And when I said I'm not sure how this relates to the naturalistic decision-making community, I was failing to tell you about the work of my colleague John Schmidt, who has done a fair amount of projects with the military, particularly with the Marines, working with people like retired General Van Riper on systems thinking approaches to Marine Corps planning and analysis, and has worked on developing exercises for creating a systems thinking mindset for Marine planners. So this is something that has been going on and is going on. So I just want to make people aware of that.
Thank you, Gary. The webinar is planned to finish in 4 minutes. I will do the formal closing of the webinar, but I have a lot of questions, and I wonder if you would like to continue after I close the webinar, and the people that want to leave after 1 hour can leave. I don't know if you and Sudeep can be for a little bit longer, Gary.
We can certainly, I can manage that, and I imagine, what do you think, Sudeep?
I'm good with that too.
Okay, so just to do the formalities in place, the webinar is recorded and will be available in the website. Also the handouts, we will update the website with link to the handouts. So I will also remind you that the call for contributions for this joint initiative is also in the website available. And last but not least, I will also like to invite you all to the next webinar that is conducted by hosting by Milena and Anthony Smokes. And it's about what the resilience engineering community can learn from air traffic management dealing with COVID. We have fantastic practitioners and we'll learn about that. It's on the 26th of November. So with that, I will continue the discussion. And then we have a question from Rihanna. So would you please explain how to be proactive when learning? Rihanna, do you want to say something about this question?
Hi, everybody. Thank you very much for this interesting webinar. It's pretty much clear. We are learning, and learning activity is some sort of being proactive to make sense of what's happening and learn about the consequences. I have some problem to understand how to be proactive here. So it's a little difficult for me to distinguish between usual learning and proactive learning. I appreciate if it's somebody sheds some light about that. Thank you very much.
Can you repeat? Is the difference between proactive learning and?
Learning, traditional learning as we know, learning.
Okay.
All right, so one of the things that we have discovered is so let's go to Danny Kahneman's book, Thinking Fast and Slow. And the idea is you have system 1 and system 2. And system 1 is a system that's really attuned for fast reactions. And system 2 is much more reflective. So that's the slow thinking. But my friend and colleague Shane Mueller points out that the learning curve just flips, that with system 1, even though the responses are very fast, the learning curve is usually very slow to build up a large corpus of prototypes and build an experience base. Whereas system 2, which is slow to in responding, the learning can be very fast because a lot of it depends on factual information. So it depends on which system you're talking about and how you're putting it into place. What we've found out is that after a certain level of expertise is reached, it's not a question of learning more material. It often becomes a question of unlearning certain earlier concepts and mindsets that have gotten you up to that point that you now have to undo. And so for proactive learning, which is where your question is headed, what we find you need to do is sort of survey what kind of mindset shifts you need to produce and create exercises and opportunities for people to make those mindset shifts and to engage in the unlearning that seems to be so important.
So David, you want to, yeah, sorry.
Yeah, so I just wanted to direct Arana to a lot of the practical stuff is happening in software engineering. And if you go to Adaptive Capacity Labs website, adaptivecapacitylabs.com, you'll find a series of materials from John Allspaw and Richard Cook on how they are implementing and helping organizations learn before a crisis or challenge event that threatens their service or operation or creates a potential failure. So the issue is in the safety world, instead of learning after the accident, it's how do you learn before the accident and modify and change things. And certainly that's related to the origins of resilience engineering in NASA's accidents in 1999 and 2003, as well as other significant ones where the information was available that they were operating outside their competence envelope, and they, under production pressure, discounted the evidence in a variety of ways, rather than being able to process and utilize it to modify, to recognize they needed to analyze, think differently, develop new plans and approaches to manage emerging signs of new forms of vulnerability and risk. So it's in the class.
Sorry, it was my mistake because I promoted to panelist and then I muted David, sorry. David will join us. I'm sure it was my mistake. I'm very sorry, but at the same, yeah, sorry, David.
So was I not, so I have to repeat, or they went through and it just was a momentary?
Just the last 30 seconds, David.
Oh, it was, I don't know where it stopped, but it was, you can see this in the origin stories around resilience engineering in the NASA accidents, where the information of new threats was available. They were operating outside their previously understood competence envelope, and it got rationalized or discounted away due to production pressure. And so they could only see the evidence. The world was different. The world of risk in this case was different than the way they had worked in the past when the catastrophe happened. So proactive is when to learn and act and modify the system before the crisis, rather than learn that we handled the crisis poorly or scramble to mediocre handle the process and then try to learn after the fact.
So I have a comment from Richard Cook, and you mentioned Richard, and I will, Richard, if you can join the discussion, I will read. A great deal of the resilience on display during the pandemic has been on the underground or off the radar work by individual small groups. They are mostly undertaken by workers not engaged within resilience engineering or NDM. Richard, you want to comment your comment, or should I? Switch out there. Oh, okay. We don't have a Richard anymore. No, left the discussion. So I will take the last comments that we have. So Rihanna.
Can I follow up Richard's comment?
Yes,
Because I think it
thank you.
makes I think we want to emphasize some common but forward-looking things as part of the purpose of our series. So the common thing underlying, remember what NDM stands for, naturalistic. And what did it start with? It started with, looking at how things work, where real people do real things with something at stake, right? This is something that we started doing as well, what became Erica and I in cognitive systems engineering, right? We were looking naturalistically at the real world. We weren't looking at laboratories, right? So when you look at the real world, what do you find? Well, Richard just pointed to it. You find you discover the fluency law, right? The fluency law is well-adapted activity hides the difficulties handled and the dilemmas resolved. That's a law. That's the way it works, period. Not optional. That's the way it works. So what Gary ran down, right? What Sudeep is getting at with some of the methods, what Richard was just referring to are all of our work in these areas empirically looking at naturalistic processes, right? Depends on techniques that gets us through the veil of fluency. We have to see beyond that. And what Eric emphasizes when he says, look at how it goes well, we're looking for the hidden adaptations, the hidden responses, the hidden forms and attributes of expertise that are so difficult to see, but so crucial to handling the unending variety and inevitable surprises the real world will throw at you. So the fundamental is, how do those techniques need to change given the trends in systems that are going on? And that's the challenge going forward, which is, how do we scale these up? Everything is operating at new scales, right? That requires us to think not about individuals, even though individual adaptations and or people in key roles adapting may be critical to how events flow and crises are handled. But rather we have to see these things and take the pandemic, where all of a sudden managers of hospital systems who didn't have to work under tempo, who didn't have to keep pace with real events, all of a sudden became part of the real-time clinical response in the spreading epidemics. They weren't used to that, and they had to modify their behavior and fit in new ways. So the challenge, RE has taken up, as Gary and Sudeep pointed to, is to work at bigger scales. And so how do you do, from a technique point of view, the big question for all of us to wrestle with is, how do you scale up the techniques in order to understand these processes of expertise, changing expertise, adaptive capacity, synchronization, fragmentation, et cetera, that play out with new relationships, new layers. And that's why we say that RE is dealing with layered networks. The science underlying this is about layered networks, not about individuals. Now, roles and individual players matter in human layered networks. But in the end, the enterprise is understanding how these layered networks work, given the tangles of complex systems and the adaptive capacity that's necessary in biological systems at any scale. And we're all biological systems, and we are them at multiple scales.
Sudeep, do you have any comments on?
No, I think that was much better articulated by Dave than I could have. So I don't really have anything much to add. I just wanted to point out that John Black wanted to use the audio to ask a question.
Okay, so in the meantime, I have a question here for George Potworowski. Any thoughts about the kind of trade-offs we would like to make quicker and integrated methods that are still valuable, again, given the dynamic and complex landscape we are facing? Would you like to comment on that, Sudeep, and then Gary, and I will give open the floor for the other person.
Kind of trade-off you would have to make for quicker methods. I think one trade-off is how do you, the system is constantly changing. So how do you keep up the learning and the drawing of insights in a way that is present, before the system has evolved into something else? So there's that trade-off between the quickness of learning and implementation, and so where do you place the learning itself? How do you time your learning, and what is the scope of that learning process? And the way you scope that is a trade-off. You can get terribly detailed and deep about how much you want to understand about the system that is already changing. So in a situation like COVID, for instance, you want to learn quickly, which means you need to prioritize what you want to learn. What insights are the most important for you to take with you as you keep working on that system. So that's one big trade-off for me in this context.
Gary?
And for me, what I'm thinking about is a wonderful book by Don Shern on reflective practitioners, because that's what I'm just echoing what Sudeep just described. With COVID-19, practitioners became more reflective than maybe they were prepared for or expected to be. They weren't just practitioners. They were heavily involved in the process of learning and making discoveries for themselves, for their units, for their hospitals. They were trying to look at ways that social media were creating opportunities and Facebook pages that they could plug into in order to keep abreast of what was going on. So the trade-off is how much of your energy goes into learning and how much of your energy is left over into performing. And you had a whole community of healthcare workers who were close to exhaustion trying to navigate that particular trade-off, and not getting an awful lot of support from their organizations. Their organizations were not rapidly configuring to provide them with the updated discoveries they needed. They had to use informal organizations and social media that they could decide. They had to decide for themselves what to trust, how often to monitor it, and how to contribute to it. So that was their trade-off, and still is.
Thank you. John Black, do you have an additional question now? Thank you for joining.
Oh, no, absolutely. Thank you guys. And Dr. Klein, obviously your work is very familiar through FSI and the military, which I've been associated with for a long time. And to your point, Sudeep, the resilience engineering, I think is got a lot of overlap. So this is my question to the group. And these are a couple assumptions, and I'm a generalist, so I realize that at a detail level, my assumptions may be picked apart, but it's more about generating the conversation. If we look at an organization as a system with systems within systems, a lot of the stuff that you already heard mentioned with systems thinking, one of the interesting things I see is, the smallest component of the system, or the system, so to speak, the individual, naturalistic decision-making, expertise, the idea of learning and everything else. And one of the things, to Dr. Klein's point that was just pointed out, is it's kind of hard to focus on learning when you're focusing on surviving, not a lot of energy left. And here we are, COVID-19 as an example of it. An interesting thing that I think that may allow sort of a conduit for overlap between the RE and the natural decision-making is simply the concept of frame or perspective. We both are looking at systems at different scale. We're both looking at that, and even go back to the military and the police world with the OODA loop. I always found it interesting that the first three parts of that sort of coincide, but why are we acting instead of learning? So again, we're cops and we're military. That's because it's what we do. But putting that aside for a minute, the key point is this learning, that we're constantly adapting, that we're scaling all the things we heard, and learning is associated with adaptability and resilience. So an interesting way of looking at it, again, just changing the frame, is some of the work being done by Cabrera with the systems approach, and he models this stuff as what's called the DSRP model, which distinction, systems, relationships, but the last part is perspective. And one of the things that I've done is, if you were to take Sudeep to your piece, the 6 sides of the hexagon, they are process oriented. But what happens if we added a different layer in it? The perspective of the expertise on those 6 sides, as compared to the perspective of the novice on the 6 sides. Would that 6-sided model from a sense-making approach look the same to the novice or the expert, or to the first-line supervisor, or to the citizen, or to the one that's fearful as compared to the one that's evidence-based? Whatever it is, one of the things they do is, by adding in the dimension of perspective, you actually get a different frame. It's like changing the perspective with Einstein. If we're hurtling towards the sun, what would it look like now when it comes to relativity? So again, my question in a long rambling way of a short question is, how might the idea of incorporating perspective allow as a conduit to overlap some of the RE and NDM type principles?
It
So,
seems exciting to me, but I would suggest, I'm thinking back to a project that Dave Woods alluded to earlier about detecting problems and understand and being sensitive to anomalies. And a key aspect of that was reframing. And the notion of reframing is sort of central to sense making and to learning. So I think that a lot of our work is sensitive to the issue of reframing, but maybe we can make it more explicit, and maybe for some of our tools, make it more explicit about capturing alternative perspectives and shifts in perspective.
John, if you look at the fundamentals that we're building up, you'll find that first off, historically in complex adaptive systems, perspective has to be a primitive fundamental concept. Scott Page at Michigan has it. He has a terrible conceptual view of perspective, but it has to be there if we're going to deal with adaptive systems. The advances in this come actually from my background in perception and attention. And if you look at the theory of graceful extensibility, you'll find out there are some fundamental constraints on perspective, bounds on perspective. It's in the original laws and the what Robert Hoffman and I did following that up. And those bounds on perspective, biological systems outmaneuver those bounds. And these are fundamentals that apply to all systems, that there's, we can't step outside the system and take an omniscient view. We're all taking local perspectives that have this quality that the view from any single point of observation simultaneously reveals and obscures. And if you want to see an instantiation of this related to very specific human machine systems, it's with ISR, with sensing systems. You can look at Alex Morrison's work and his dissertation, or the handbook chapter we have that illustrates these properties of perspective when the perspective is mediated by sensors on robotic platforms of various kinds. And I would encourage you, if you send me, I can send you that handbook chapter, because it's kind of hard to find unless, I think we have, it's on my ResearchGate page too, from Handbook of Applied Perception. But you would find that that's one of the fundamentals is this perspective contrast, perspective shifting has to be enabled and supported, which immediately suggests we need to think of beyond an individual. So yes, an individual can reframe, but one of the findings about reframing and insight is it works better when there's properties of interaction with others. Same with hypothesis generation. Nobody by themselves can generate consistently sufficiently wide set of potential hypotheses. You need interaction with the world and multiple perspectives in order to generate more potential hypotheses to account for anomalous behavior of a system. So this really is quite fundamental stuff that has continues over my career to not have as big an impact on our designs and technology, and certainly our automated systems as it should have and can practically have.
And David, I would agree with everything you said, and a lot of the work that you've cited is stuff that I've read and I use myself. So you have no disagreement with me. But your last comment to me is the most telling. It's that it's foundational, and we recognize we should be doing it, and it isn't used as much as we should be using it. This foundational concept of multiple perspectives bring other things to the system. So again, to both of the main speakers, the idea of we're seeing these overlaps, and this is just another dimension of it. It's, to me, and this is, again, I'm narrow in that I'm doing both business strategy, police, law enforcement, and military strategy. But the idea then is, how do we bring in the importance of the benefit, and Dr. Klein, you already cited Schmidt's work and everything else, but we know this. We've seen systems, we've seen it in planning and bureaucracies and big companies, and resilience engineering, that organizations have to be adaptable. There's a recent article just on asymmetric thinking and special operations, where I come from, about why its benefit is its adaptability. Is in the two models that you just described and in the multiple tools that you described, maybe a better way to frame this question is, how can we create the natural progression that perspective is included within the tools that are currently being used?
Thank you.
Well,
I have a follow-up. I wonder
I'll
if
give
we
a
can...
short answer. Short answer, John, is start with what Gary said on reframing and autonomous systems, right? All the AI and stuff, none of it even tries to do reframing. It assumes it's not necessary because their algorithm is so great. And designing autonomy to reframe would shock them because it's hard. And people are the only extant computational system that can reframe. And it's one of the fundamental limits on all the AI hype, past and present. So I would look for your help in helping to wave that flag. Thank you. I told you should keep control of my mute button, Yvonne.
But now Sudeep wants to talk, but I want to give the floor to Tanya because she had a comment. I wonder if you want to share your view, Tanya. There is some movement in the business world.
From the perspective that I have, there seems to be a wave going on right now, like not only in the whole safety, whatever label you want to put on it, but in the business community as well. There's a recognition, and it's being, there's podcasts on it. There's I put the movie in the chat of, the current models that a lot of the Western world have been using in the business world are not serving the business world anymore. And so they have to start looking at different ways to look at how to operate. And, and it's the same message, just different players kind of thing. So that's all I wanted to say. There seems to be maybe there's a turning point that we're approaching from a whole bunch of different angles, but they're all pointing in the same direction. So there might be some synergies across a whole plethora of fields, all going in the same way, which I haven't necessarily seen before.
So I just want to, well, hopefully this webinar and the series helps accomplish that direction. But I want to get back to the discussion earlier about reframing. So John, this is kind of a question to a question. When you talk about different perspectives being incorporated, how do you draw the boundaries between different perspectives? For instance, you can call a novice perspective and an experienced perspective based on who is giving you different perspectives. there could be perspectives from just different groups within an organization. So I think part of actually doing the reframing systematically would call for defining those boundaries, right?
Absolutely, and there's a lot more experience on this webinar than I can speak to. The one thing I can tell you is that my first sort of off the top of my head answer for just practical experience, we'll call it from a anecdotal type of thing, is that I would argue in today's world, and some of the stuff that Tanya was speaking to about how we're beginning to see a shift, and I think that's true. I've seen the same thing. It's not as quick as I'd like, and it's maybe not as inclusive as I'd like, but it's better than it was. Just the fact that nonlinear approaches in a military paradigm is a shift in and of itself. You want to talk about trying to get cops and military to think differently, and I'm one of them, so I get it. Sense making, and in other words, the idea is if we walk into it from a perspective to let the self-determinization of a good sense making process that allows those people to design what perspectives in and of themselves, not the researcher, but the person that's actually in the middle of the system. The idea is, how do we do, we'll call it the relevant perceptive detection as to design where the boundaries are. So I think at some point, and Dr. Klein brought it up, we have the one idea of the skeleton concept map. We could walk in there with guiding, nudging idea of giving them some place to keep the conversation going. But the goal would be is that their sense-making conversation would help determine the boundaries and give us greater clarity. And then the other part would be it's constantly dynamic and iterative. If we get it wrong, then just freaking change it. Don't worry about it that much. Just keep moving on. And that's the very nature with Snowden and Knevin and the other type of things that you see is that it is dynamic. Systems live or they die. And so the thing is systems can help determine their own self-reflection, whether it's a corporation, an organization level system, or whether it's the human. So initial thoughts.
Gary, you want to comment, or Sudeep?
I'll let Gary go.
Said seems reasonable, and seems like perhaps a nice wrap up for our discussion for our webinar. So thank you, John.
Yeah. So
More than welcome, sir.
I wonder if we can do a closure at 6:30, and I would like to ask you one thing to keep and one thing to improve. What are your lessons learned from this webinar? And I would like to ask some of the participants. Jean-Paris, you have been quite quiet. So is there something that you would like to keep or change for next webinar? Bonsoir, Jean.
I was only impressed. So I kept quiet. Oh, I think it's a very interesting seminar, webinar, sorry. And I start to understand maybe the underlying rationale behind the convergence between the two movements. I think there's a lot, and actually a lot more than I initially imagined. I think it's a very interesting step in this convergent movement.
Thank you. Lars Axby, do you have some comment on this webinar?
Well, first of all, a big thanks for letting us join and listen in. Well, I'm standing in the practical domain very deeply, working with maritime pilotage, and I was very happy to listen and hear about the different concepts here, which I will think about and consider using. Thanks.
Thank you, Lars. Clifford, you have been joining some of the webinars. Do you have some comments on this kind of event? Or what you learned from today? Okay. So I would like to leave the floor to, yes, Clifford, sorry.
I apologize, I was on mute. Just to say that it's very helpful. Dr. Klein's perspective overlaps very well with resilience engineering, and the ideas and the concepts have helped me to think about this in a different way where I can definitely make more of an impact here at work. So I thank everybody.
Thank you, Clifford. Stephen, thank you to join us suddenly in the discussion. Do you have some things that you would like to bring to the table for the future or for now?
I just put a link in the chat box there to some small narratives about, I don't know, 30 or so. I have about 40 or 50 or so from healthcare practitioners, anesthetists or anesthesiologists, surgeons, radiographers, nurses, and so on. I just basically asked them in about 100 words to tell me what they've learned from their point of view of their practice from the COVID-19. And the responses have been, you know, really, really fascinating. And I only asked them to limit to 100 words to get a chance of them responding, because if I say 500, they're never going to respond. So anyway, the link is there, and as I get more, I keep adding to them, and you'll see the themes of adaptation, flattened hierarchies, you know, much more focus on change and decision making done by people rather than to people or for people. So there's some just really interesting short narratives from the horse's mouths, so to speak. And I think this short narrative approach is a good way to learn on a fairly continuous basis. At least I found it to be so, but thanks for the invitation to join in.
Yeah, thank you very much. And I see a comment from David Woods. We will take care of all the precious sharing of information, a lot of links. So we will also clean all the comments and questions that have been there, and we will share it together with the webinar. So Gary and Sudeep, thank you very much. It has been a lot of preparation from your side. You would like to have some ending remarks?
I appreciate the opportunity to work with Sudeep and to have this discussion with the larger community. I've found it very valuable and stimulating. So thank you, Ivana and the Resilience Engineering Group.
Yeah, thank you, Yvonne. And I want to echo Gary, and I also want to thank Gary because it's been a huge learning experience for me in preparing for this webinar. And I'm looking forward to the series.
Okay. Thank you all. We will keep you safe, and thank you very much. I will close the meeting.
Gary, are you still there?
I am, yes, David.
How are you doing? How's Helen?
We are doing okay, but let's have a private conversation, David.
Let's tell the world, come on. Everybody wants to hang on so long. I thought everybody would be rushing off to their other jobs and Zoom calls and things. So
yeah,
anyway,
I wonder, yeah.
So
let's slowly dropping off. Yeah.
To talk, David. Okay.
Okay. Bye.
Need to run.
I was thinking we could do a debriefing, but maybe we can do it afterwards with Sudeep by written. But it was, I think it was at some point we have over 100 people participating, Gary.
Mm-hmm. I saw.
Yeah. Yes. Thank you very much.
Bye-bye.
Gary, hello, are you still there?
Yes.
Pedro speaking, sorry. I don't have my camera on. Just have a look at my last email if you can, and give me some feedback. Just it would be good for us to, if I can, I would get a move on it still today and not leave it for the week after.
Okay, I haven't had a chance to read the emails.
Yeah, sure. I know, no worries. If you get a chance.
As soon as we are finished with this webinar.
All right. Okay. Thank you.
I'll respond maybe this afternoon.
Okay.